now. All right, we're starting right on time
Yeah,
here, and
yeah,
for the most
yeah.
part, oh, sorry, could you guys mute, please? Anyone who's off mute, if you could mute, please, that would be great. Um, I am going to be passing this over to Grace Reef. She is the specialist. I'm going to stop my recording here for a minute. And then for her knowledge, maybe if you guys could all take a minute and put in the chat your name and affiliation, just so we kind of get an idea of who the audience is today. I know that from the folks who have said yes, we have anywhere from early childhood folks to economic development to business owners, statewide advocates in different capacities. So please feel free to put that in the chat so we get to know who you are. And if you'd like to put your location, feel free to do that as well. With that, Grace, I believe you should be able to share your slides now, and we will just pass it over to you.
Okay, well, thank you, Kayla, and thank you everyone for spending time out of your busy day to join us today. I do have some slides and I will bring them up, but I also want to say I will send the slide deck to Kayla so that it will be available and she can disseminate it to, anybody who's joined today. I'm also glad to answer any questions, and you can do it one of two ways. You can be polite and wait to the end and then, ask your question. Or if I say something on a slide and you have a question about it, I'm okay with people saying, "Hey, I have a question." Because I would much rather address it now in the moment than kind of wait politely till the end. But that's just me. So you do what works best for you. And I hope this is a good session today. So hang tight, and I am going to get my slide deck. Okay, so hopefully you now see the cover slide. Somebody gives me a thumbs up or wave just to make sure you guys can see it. Excellent.
Looks good, Grace. Thanks.
Okay, so I am a senior outreach consultant for the Committee for Economic Development. They are a business-led national organization in DC, but they're business leaders from throughout the country. They have long had an interest in early childhood. I would tell you for more than 50 years, they have put out economic impact reports, reports about preschool, reports about access to childcare and labor force participation of moms. In South Dakota, you have one of the highest labor force participation of women and moms in the country. So I don't need to tell you about that. But today we're going to talk about two things. I'm going to give you a brief update on recent congressional action. Basically, where are we now with the federal budget and what could be coming to South Dakota? And then I'm going to do an overview of the Child Care and Development Fund final rule highlights. And so, as I said, glad to answer questions. And with that, we're going to get to the funding overview. Congress, they do many things. One of them that they could probably do a better job on is passing appropriation bills on time. And so technically, the fiscal year starts October 1, but I don't know, last 10 plus years, they haven't really made that October 1 deadline. They kind of exist by continuing resolution. Sometimes there are many of them. And so what I wanted to let you know was fiscal year 2024 started October 1. But it wasn't until March that Congress was able to complete action on legislation, appropriation bills for fiscal year 2024. So let's talk a little bit about what was in that bill. And this money will be going out to states soon. because the next fiscal year 2025, starts October 1. So this money will go out to states shortly. So this legislation passed, this appropriations bill. It consolidated 7 or 8 other big bills. And it included funding for the labor, health and human services, and education appropriation bills. Childcare is one of the items in that bill. For childcare, there was a 725 million increase in funds. That goes out to states by a formula. It has to do with your population, number of kids. But there was a big increase. And in the context, 725 million was quite large because many programs were frozen and some were cut. So childcare was a priority and there was an increase. I listed some of the other programs in case you care about them, and what their funding level was. There was an increase for Head Start, preschool development grants. I can't remember if South Dakota gets that grant or not. It's something that states apply for, and then it's a competitive award process. That was frozen. Community Services Block Grant, sometimes referred to as CSBG. Many CAP agencies also have childcare programs, so I put that on the slide. In other programs, I won't go through each of them because today we're going to talk about childcare, but I did want to list them in case you were interested. So South Dakota, what does this 725 million increase mean for South Dakota? Basically, it means the state will get an increase of slightly more than $2 million. It doesn't sound much, but when you figure that 725 million increase is divided by 50 states and it's a formula and it's based on population, 2 million in the context of the funding that South Dakota receives is a sizable increase. In general, for fiscal year 24, there's 32 million for childcare from the federal government. And just for context, in fiscal year 2023, there was 29.9 million. So 2 million increase. I know some people say, oh, wait a minute, I thought there was like a ton more money than that. So I did want to mention the American Rescue Plan, which was enacted in March of 2021. That included enormous increases in childcare in an effort to stabilize the market and make sure that parents had access to care. For stabilization money, South Dakota received 61.8 million. For, it's called extra CCDF, a supplement to the regular annual appropriation bill. South Dakota received 38.6 million. And the total for fiscal year 2021 was slightly more than 149 million. The stabilization money, states had to spend that by September 30th, 2023. So that money is done. The CCDF supplement money, the 38.6 million, states received it in fiscal year 2021, but they actually have until September 30th, 2024 to spend it. So I don't know where the state is on spending that supplemental money, but just to say that money is available until the end of September. It's still potentially out there if the state hasn't already spent it.
Hey, Grace.
Mhm.
I'm just going to jump in. Just for context, some of you, if you're providers, those are those big grants that you received for operational dollars. If you are economic development, the money that Grace mentioned that you can spend until September of this year, those are the Governor's Office of Economic Development, community planning grants. That's where some of that money is coming from.
So the next question, I know, if I were you, okay, well, you told us the next fiscal year starts in October, fiscal year 2025. When do we know about that money? That would be a great question, but I don't have a crystal ball. And what I can tell you is technically the next fiscal year does start October 1st, but it wouldn't surprise me if a continuing resolution to keep the government funding is put into place, passed by Congress until they can make final decisions. But now that they, in March enacted the fiscal year 2024 money, Next up is consideration of what will these programs get for fiscal year 2025. They may decide that before October 1, or it may be sometime later in the fall. But that does require legislation. So right now it's an unknown. I just mentioned it so you know this money is good through September 30th, and then the next fiscal year starts October 1. So the primary purpose of today is to go over the Child Care and Development Fund final rule. What is it? What's in it? It affects people differently depending on if you're a provider or a provider who takes subsidy funds, or the state agency who administers funds, or a family looking for care. So all these people this rule touches all these people in different ways. It is designed big picture wise to lower the cost of care for families, to increase options for families. So when they're looking for care, it might be more providers to choose from. To strengthen the payment practices for childcare providers, that's a big one. And I have a slide on that, so I can get into it in more detail. This will be, I think, a big change for providers to speed up the process for them to receive funding. Instead of being reimbursed, they're going to get it up front. And it should make enrollment in the subsidy program easier for families. So that's what I'm going to go through. Technically, this rule becomes effective next week, April 30th. However, states are allowed to apply for waivers, and those waivers are good for up to 2 years. If a state does apply for a waiver, HHS has to approve it. The state has to explain which provision do they want to waive, and what do they have to put into place in order to come into compliance, and what special things might need to be considered. Like, some states may have to pass legislation to do some of these things. Not all states, but some may. And all of this, the final rule and all of the state policies related to childcare, licensing, professional development, subsidy, all of those things are included in the state plan. Every state is required to put together a state plan. It's not really a freebie for states. It's a 118-page template where states are asked specific questions. Some of them are yes or no. Do you do this? Do you, not? If you do, give us a link, show us. If you don't, how come? What's your policy? And others are, share your strategy for this or that, or share your policy for this or that. But it's a 180-page document. So it's a huge, huge undertaking by states to fill it out. That plan has to be made public by law. There has to be at least one hearing by law, and it has to be filed with HHS by July 1. And every state who wants to receive federal money for childcare has to have an approved state plan. So it's a big deal. I don't know in South Dakota if the draft plan has been made public yet, but that should happen soonish, because they have to hold a hearing, receive public input. There may be areas that they change. I don't know. The final plan has to be filed with the Department of Health and Human Services by July 1, and it becomes effective October 1. If you want more information, I've just included some links, like what is the final rule? Where is it? It's printed in the Federal Register. It's a public document. There's a link to it. I wrote a rule summary that breaks it down. It's like a 50-page rule, so my summary is 4 pages. I usually like to do 1-pagers, but this is a 4-page summary, so you can click on that. And CED also had put together a policy backgrounder, so you can click on that link and read more. So let's talk about childcare affordability. What is this bill doing for families? What is this final rule doing for families? Right now, states, it's up to states, but they charge a copay. So a family is eligible based on their income, and there's some type of copay. And in most states, it's a sliding fee scale. So as your income goes up, your copay is probably going to go up. Every state structures it differently. But what this final rule says is, hey, states, for affordability, we see across the board what states are doing, and they're all over the map. And in some states, like the copay is like 30%. It's pretty high. So what the final rule says, to maximize parent choice in childcare providers and to make sure that low wage earning families can have access to childcare, we're going to put a copay limit of 7% on family income. So many states say, here's a copay, and it's by child. You know, if you have 2 or 3 kids and they're eligible for subsidy, that copay really can add up. And what this is saying is, regardless of the number of kids in your family, there's going to be a family copay of 7% of family income. You can't exceed that. So what this means for states is that, you know, some states it may be in statute, the copay, or some states it may be, you know, in regs of some type, but there is, you know, process in every state to set it, and they'll have to go back and review it and see if they're above 7%. And if they are, they'll have to go limit copays to 7% of family income. And, you know, they could go lower if they want, but they can't go higher. For copay waivers, what that means is this is not the state waiver. Copay waiver means in some cases, families won't be charged a copay. And what the final rule says is, hey, we used to say if you're a family living in poverty, you can waive the copay for families living in poverty. But now what HHS is saying, wow, that hasn't been adjusted in decades, and you know the poverty level is really quite low. We're going to allow you without special consideration, you know, filing more paperwork, if you want to waive the copay for families at 150% of poverty or below. So that's more generous than currently. What the final rule also says is, if you have families with a child with disability and you want to waive copays for families, for that type of family, you can. If you have families with a child in foster care or kinship care and you want to waive copays for them, you can. Families experiencing homelessness, if you want to waive copays for them, you can. Families enrolled in Head Start or early Head Start, you can waive copays for them. So these aren't the um, only areas where a state can waive copays for families, but they're ones that states won't have to seek approval from HHS to do. So there could be others, you know, other reasons, you know, that that a state may want to provide a copay waiver. And if they do, they can just put in the state plan what type of family they might want to waive the copay for and their rationale. And then HHS can, you know, review it and approve it or reject it. But at least on these categories, if the state wants to do it, no, you know, questions asked, they can do that. It's a policy priority.
Grace, I'm gonna pause you just for 1 second. There's a couple people off mute. Do any of you off mute have a question? Okay. Just
Hey,
as a reminder to mute yourselves if you
Kayla,
do have a question. Thank you.
when I'm going over the slides, can you just take a look at the chat just in case there are questions, because I might not see them.
Yep, I will absolutely do that.
Okay, thanks. So just a couple of notes so you know, when there's a waiver for a child with a disability, it applies to the whole family. So any siblings who might be on subsidy, it's a family type of waiver. I guess the last thing to note is the final rule requires states to post this information. Like in some states, I don't know how South Dakota does it, but in some states, it's actually kind of hard if you're a family applying for childcare subsidy to understand what your copay will be. And so what this final rule says is, hey, you gotta post this, make it publicly available so that families understand when they apply how much they would be required to pay based on their income. Or not, if, that family might be eligible for a state waiver. The copays are sometimes hard to find on state websites. So this is just kind of a notice to states. Please, we're going to require you to post the information so that families who are applying, can understand it. So expanding parent choices and provider stability. Grants and contracts. I don't know if South Dakota currently does contracts with providers. They may, I don't know. But what I can tell you is that the final rule requires states to use at least some of their funding for grants and contracts to provide slots for certain children, for children in underserved areas, for infants and toddlers, and for children with disabilities. Some is not defined. So, it may be that a state wants to do it in a couple of pilot communities to see how it works and fine tune it. Or it may be that, a state wants to, start off with something that can be reviewed, evaluated. But states are required to use some, so we'll have to see, what states decide to do. Prospective payments. This is a big change, huge change for states. Right now, the way it currently works, most states reimburse providers who care for children on subsidy. And so this requires that states pay upfront, either at the delivery of services or at the beginning of when services are scheduled to begin. So it's called prospective payments. But I think the best way to look at it is this final rule says, hey, we're going to align subsidy payment policies with the way private pay families pay. And private pay families pay upfront. If your kid has pink eye and is out a week, parents are still paying. If they, get COVID or, something else and they're out, parents are still paying. So what this is saying to states is, number one, you're going to pay upfront the way the private pay market works. And two, on the next bullet where it says pay on enrollment, I think South Dakota already does this actually. You're going to pay based on authorized enrollment, not attendance. So it's kind of a combo. One, pay upfront. Two, pay based on enrollment. But for many states, this will be a big change. It may require, software technology changes. But
Great.
for providers, yep.
We did just enact that January 1st, and there's kind of a workaround right now due to our archaic system, but they are working on getting a new system for those on the call.
Oh, really? Okay.
Yeah, Grace, that was gonna be my question, was like with our rule change, there's also it's like a 10-day, you can't exceed a certain number of absence days in a row. Will this override that if we continue to authorize their enrollment, or we don't know
Yes.
yet?
Oh, no. We know. The federal
Okay.
guidance is clear. Payment is on authorized enrollment. You don't go
Not
by
on any kind of attendance, so.
no attendance. And in the
Great.
preamble, which is the explanation to the final rule, it explains that.
Okay.
Even if you were to say, hey, you can have no more than 156 days, sick days a year, which is pretty generous.
Mhm.
No, this is not hooked to attendance in any way, shape, or manner. This is hooked to authorized enrollment.
Great.
Now, there are
Thank you.
circumstances where, for whatever reason, it's a ghost child, payment is authorized and the child never shows up. There is a responsibility to work with the state to identify, that type of situation. But really, it's
We're still not
best-
allowed to commit fraud, huh, Grace?
right. I mean, no, like they're going to be paying attention to,
Yeah.
potential fraud.
Right,
But the
right.
idea is better support
Yes,
the provision of childcare, the same way that private pay parents pay upfront,
yeah,
pay whether
yeah,
their kid attends or not.
yeah, absolutely. Okay, thanks a lot, Grace. I appreciate that.
Sure. The other thing that this rule does is it clarifies, and I don't know what the state policy is in South Dakota, but it clarifies that, look, the state may come out with subsidy rates based on their, market rate survey. And some states have said, oh, our market rate survey shows, I'm making this up, $100 a week for infant care. And so the state will cap payments at that $100. This clarifies that states can pay above what the provider's private pay rate is to increase quality, to build supply, to better reflect the cost of care, for high cost of care, on running a program. So this will be a big change for states that were not sure about it before. This is not like new policy. It's just clarified and put into a better explanation that states don't have to cap the amount at what is charged for private pay kids. So expanding access to subsidy and reducing, I call it bureaucracy, but it might be a better word for it. Presumptive eligibility, what's that? This clarifies that states can say, hey, if a family is eligible for some other programs, we don't have to make them prove it again, and bring in 8 different types of, ID and stuff like that. So presumptive eligibility means if there are those who are already participating in a different program, you can expedite their eligibility for subsidy. So you don't have to wait for, mom or dad to cart in all the different types of documents that might show that they're eligible. Eligibility simplification. This clarifies that states can choose to simplify the verification process. And again, there are multiple types of programs. You might have SNAP, you might have Medicaid, you might have your state children's health insurance program. You might have other things that families are eligible for. And so if there's a way to streamline that, states are encouraged to do so.
Great.
Additional children in the family.
Grace, hold on. Sorry,
Yep.
there's a question.
Sure.
Can you hear me okay?
Yep.
This is Jess Gromer. I am looking at the presumptive eligibility. I just attended a session on SNAP and they brought up broad-based categorical eligibility, or BBCE.
Yep.
Does a state have to participate in that to
No.
do this?
Jessica, great question. These are clarifications so that states understand the breadth of what they can do. And all states, I'm sure state agencies will review not just the rule, but the preamble, which is the verbiage, the explanation of why, the rule is here and why some of these decisions are made. And what's driving the eligibility simplification and presumptive eligibility is to serve families faster. You're a family with low wages, and let's say you need childcare like tomorrow, right? Or you find out you get a job and you're going to midweek and you're going to start the following Monday. You don't have 45 or 60 days for states to, figure out whether or not you've got the documents to show to qualify. So this is really erring on the side of families. And what the rule says is we're going to allow you to, expedite consideration of subsidy as soon as possible. It could be the next day. And we're going to give you 3 months to get all that verification in place. And after that time, if a family's not eligible, they can be kicked off. Or if it only takes a month or 2 months instead of the 3, and you find that they're not eligible, you can stop payment and they're off. But what the rule says is we really want you to help families as soon as possible so that people can get and keep a job. And childcare is so important. And so the bureaucracy of proving that you're eligible for this or that can we go to what is best for the families? Like they need childcare so they can work. So states are told, if you're doing your best and you set up some criteria and you expedite this process, we're not going to ding you. We're not going to penalize you for making a mistake. Do your best, but set some criteria. But we are urging you to expedite this process so families get help as soon as possible. And we're going to give you this 3-month window to do it in. So really the difference is whether a family waits 2 months for, somebody to verify that they're eligible, or whether they could start childcare right away. And it's within that 3-month window. And most of the families will probably be eligible. And so everything will go on as it should. And for those that aren't eligible, the payments will stop. And the other thing to note about it is in the preamble, it's explained to providers, if you are serving one of these kids and in the small category of families that turn out not to be eligible, the state won't come after you for those payments. Everyone's doing the best they can. Criteria was set. We're trying to expedite it for families. But if a mistake was made or a family turns out not to be eligible, we're not going to come after you providers. So that's
And
part
then-
of the.
Grace, if I can ask too, we have some pretty steep eligibility requirements here in South Dakota. Does this speak to those at all, or is the state that's still at the state's discretion?
I'm not. Can you give me an example?
Well, we have to have, you have to, for example, if you have a single mom, have to have um
Child support.
child support or open child support case, or you have to have the father, legally, whatever, the father's gone, things like that. There's also some things to do with timelines, but
Well, what I
yeah,
can tell you is
that's the big one.
right. The rule didn't touch the child support one.
Okay.
But what I can tell you, and I don't have the data in front of me, but I can get back to you on it and give the information to Kayla and she can give it to you.
Mhm.
But there might only be 10 or 11 states now that's still holding on to that
Yeah.
child requirement.
Yeah.
And many states have done away with it. And they've done away with it for a variety of reasons. But, I've just worked with Kayla on some surveys, for example, in different communities in South Dakota. And one of the questions is, have you ever received subsidy? And another question is, if you, first is, do you know about the subsidy program? And shockingly, half of the parents aren't. And then second, they're asked if you applied and didn't get it, and
Mhm.
you are okay sharing with us the reason, can you let us know why, but don't
Mhm.
reveal it confidentially?
Mhm.
And I'm surprised to see the number of families who said, look, the dad's not even on the birth certificate. I don't want anything from him. He's just
Yeah.
a
Yeah.
real hassle to
Yeah.
me, and I don't want
Yeah.
to bring that drama into my life.
Yeah.
And there are a number of people who said things like that, domestic
Mhm.
violence or unstable or drinking or
Mhm.
just, they just
Right.
don't want
This
it.
is a
Right?
bigger danger than the money.
That is something you really have to do if it's a state law through legislation or if it's a state
Okay.
regulation through regs. That the federal rule didn't touch it because it's not a
Right.
federal requirement. States have
Right.
done this. But I
Right.
kind of feel like if you understand that that child support thing came about, I want to say maybe the 90s or the 80s, it was part
Mhm.
of welfare. It was like, you're not going to get a dime of welfare from me unless you first get what's owed to you in child support. So it was a way
Right.
that it's kept the welfare caseloads down, right?
Yeah.
But now
Yeah.
we're at a different place. First of all,
Yeah.
child care assistance is not welfare. Child
Yeah.
care assistance doesn't even have a link to welfare. Child care assistance is for lower wage families to help them get and keep a job and be working, right?
Right.
So that they don't
Right.
need welfare. And so, I highly encourage you to think through, what these parents are saying and what the real impact is on a family
Mhm.
and whether the drama is helpful for a child and the impact on that child.
Mhm.
And maybe it's time to, review it.
Okay. Yeah. Thank
Yeah.
you, Grace. I appreciate that.
Okay. So additional children in the family. It's kind of a common sense thing, but what the rule does is clarify that the 12-month eligibility requirement. So if you get your family, your child gets a subsidy, you're eligible for 12 months. So you don't have to go reprove every 4 months or 6 months that you're still eligible for the program. That's what it used to be before 2014. Then the Child Care and Development Block Grant was reauthorized. And every family, once you're eligible, you got 12 months of assistance as long as you were still working. What this clarifies is if another child is born, if you have a child in foster care that, comes to you, or if an additional child in the family who maybe previously didn't need childcare but now does qualifies, that you don't have to have one family. Let's say they have 2 or 3 kids, and each kid has their own 12-month mark. And you have to keep like a calendar of when do I expire, which child. Ben expires in May, and Sally expires in July, and Joe expires in September. No, what the rule clarifies is, hey, states, make it easy on yourself, streamline it. So if a child, let's say a baby is born and comes later into the family and then qualifies for infant care subsidy, put the whole family on that schedule, right? 12-month is a minimum. It's not a maximum. So you could have that child the first child be on for maybe 14 months if that puts everybody in sync. So this is like a common sense thing to states to clarify that they can do this if they want to. And then on online applications, what's not new, it's actually in the law. So I was surprised to see it in the rule. It requires states to implement eligibility policies and procedures that don't disrupt a working parent's schedule, right? Like, sometimes you have to go, depending on the state, stand in line for a couple of hours. You have to take off work to do so. You have to either initially apply or recertify. And what the rule said is, hey, we are requiring you not to turn upside down the work life of somebody to get assistance. Let's figure this out. So it's really not new. It's in the law, but it's also in the final rule. So I assume some states must not have been doing that. And what the rule, it doesn't require, but it encourages states to use an online application. And it actually goes a little bit further. Don't take that like paper application of 5 pages and make the PDF appear like online. It's saying, yeah, we want you to do online applications, but take a look at the application. Other further simplifications you can make and put that simplified version online, not just here's the PDF, you can download it. And then the other thing is there are some expenses states were thinking came under admin, and there's an admin cap on the amount of money that states spend. So this is saying, no, you want to improve your software systems? That's not admin money. That's service, that's quality, that's delivery. So just clarifying so that states would know that they can use, any of their childcare dollars, but doesn't have to come under the administrative cap. So miscellaneous, I didn't know what else to call this slide, but these were 2 things that didn't really fit under the other categories. Criminal background checks. This is still a work in progress for states. Most states are in compliance, but still struggle a little bit with the interstate background checks. What the final rule says is, look, employment eligibility decisions have to be based on results. So apparently there were some states that allowed people to work in childcare just because they submitted their fingerprints or they submitted their application for CARI check, child abuse registry check. So this is clarifying, no, it's not the submission of, it's actually the results from. And then second, only states make these decisions about whether someone's eligible to work in childcare or not providers. This is a state decision. And third, I guess this was a problem across states. I didn't know that, and I follow background checks pretty closely. Child pornography is apparently defined differently in a lot of different states, and sometimes it's a misdemeanor, and sometimes it's a higher charge. But what this is saying is, look, child pornography is a disqualifying offense across all states. So that is something that was added, I think, because of inconsistencies across the states. One thing, I wasn't sure what other slide this would be applicable on, so I just put it on this last one. So states do a market rate survey. States also do their state plan. What is the final rule requires is states to collect the charges in excess of the subsidy rates as part of the market rate survey. And what that means is, let's say the subsidy rate is $100 a week, but the provider charges $150. So in theory, the family has its copay, and if the provider wanted to fill that delta between the private pay rate of $150 and the subsidy rate of $100, then the family could be charged the $52. So this doesn't prohibit providers from charging that delta amount. But what it does say is, hey, states, when you go out for the market rate survey and you find out, by setting, by age of child, what the prices are, by community, you also ask providers if they're charging families the difference and what, they're charging. So the market rate survey will include both what the private pay market rates are by age of child, by setting, what the subsidy rate is that the state pays, which is based on many cases of market rate survey, although could be based on cost modeling for states that decide to go that way. But also the question will be asked on the market rate as part of the market rate survey. Do you charge families for that delta between the private pay rate and the subsidy rate? And if so, how much? So that will become part of the market rate survey. Yep.
Grace, this is Jess again. I'm pretty sure you answered my question, but on this, it requires states to collect charges in excess. It's collect the information on charged excess, but not literally collecting the dollars. Okay.
Right. I could have said that. Yeah, I guess I could have said that more clearly. Right. No, the state will not be collecting any money.
Gotcha.
The
Okay.
state wants to understand, what's the provider policy? What's the provider practice? First, do they charge the amount between the delta? And second, how much is it? So the market rate survey will collect information about rates and excess payments. And then last, major renovation. This was an area that was like way more complicated than it needed to be and was being implemented differently across states. And it was kind of like, the law prohibits states from using child care and development block grant funds for construction. And so over time, construction and major renovation were defined in a different way, like load-bearing wall. I mean, there were all these like conditions on it. And it was really complicated. It was kind of gray. And so what the final rule says is, no, we're going to take another stab at this because the old way was too confusing. We're going to define major renovation to be based on the cost of the renovations. So anything at $350,000 or below with regard to a childcare center will not be considered major renovation. Anything at $50,000 or below for family childcare homes will not be considered a major renovation. And these thresholds, they'll be adjusted annually. And so I think they're trying to get out of the business of the brick and mortar load-bearing wall fuzziness to something clear. Is it 350,000 or less? Is it 50,000 or less? But very clear across states. And so I think this will be helpful in a lot of ways for states to work with providers to expand capacity potentially without running into that prohibition on the use of construction in major renovation. So that's what that is about.
Oh, sorry, Grace, I just want you to go back to that if you can for 1 second. The
Sure.
threshold of 350,000, you said this is aimed at giving providers the opportunity to expand access to childcare. Okay.
Well, first, I want to preface it by saying it's state choice whether states decide to spend the money in this way. But
Mhm.
if they did decide to spend the money in this way, they could go up to these thresholds.
Gotcha.
So they won't have to go with, is it a load bearing wall? You know,
Right.
does it expand the
Okay.
purpose of the original facility? Like,
Mhm.
all
Yep.
these crazy brick and mortar type of rules. Those are
Right.
out the window. That is all deleted. And in its place, these are the bottom line points. It's
Right.
simple, right? Is it 350,000 or less? Is it 50,000 or less? Right? And it's
Right.
going to be adjusted for inflation. So I think it's still at the discretion of the state as to whether they want to
Yep.
use the money this way. But if they did want to, they could
Yep.
without
That sounds
somehow
great.
running, afoul of the law.
Yes, that sounds great. Thank you.
Sure. So that was it. And Kayla can make my slides available. And I'm glad to answer any questions that you have.
Grace, I know there'll probably be lots of questions, but one I don't know for sure if we hit on for everybody to know is what is the timeline for these rules to be implemented in states? And again, reminding people that some of these are requirements of states and some of them are state choice. But what is the timeline?
Right. So technically, these rules go in place, become effective April 30th. So next week. But states can pick and choose and say, oh, this will take a bill to go through the legislature. I want to ask for a waiver. This one will take money. We have to change our software system. I mean, there could be legitimate reasons that a state may not be able to say, hey, it's April 1, we're good, we're ready to go. We're going to just, like a light switch, make all these things happen. I think it's not like a light switch, and it will vary by what the state policies are and how easy or quickly a state, can do it. And so that's why they are effective April 30th, but states can apply for a waiver, and those waivers are good for up to 2 years, and they can be individualized. I'm going to apply, I'm making this up, but I'm going to apply for a waiver on prospective payments. Oh, on enrollment, yeah, we have it hooked now, no 10 days in a row, but that's easy enough for us to change. We just put out a rule on that or a memo on that, or maybe that's something where they modify their regs. That one they might be able to do without legislative approval unless it's in state law. But there may be other things that, like the 7% cap, 7%, 7% of family income cap on what the co-pays can be per family. That may be something you need state legislation for. I don't know what the state law is, but the reason for the waivers is for states to figure out what could we do immediately, what could we do that might require a new law, what might require whatever that regulatory process is for the state, town hall meetings or whatever's involved. How quickly can we do that? And so the waiver can be for multiple things as long as they have an explanation of why and when they expect to come into compliance. But the preamble to the final rule was pretty clear. We're not going to extend these waivers. It's up to 2 years and that's it. These are not going to be like kick the can down the road forever waivers.
Grace, there was a question that came in just now in the chat. It says, do these rules make childcare costs or the availability of childcare services better in South Dakota?
I think they could, but it depends on, actions by the state. I'll give you an example. There are some questions in the state plan. Let's see if I can send you a link. Oh, the link to the state plan is in the slide. But there's some questions in the state plan, like, have you identified a shortage of infant and toddler care? Have you identified a shortage of non-traditional hour care? What do you plan to do about it? So I think, one, the state will have to, get the right seats around the table to talk about what's going on in different communities, and then say, what can we do, partner on, help with to address those things, like infant toddler care is often in shortage, not just in South Dakota, but across the country. What can they do? So, for example, maybe they'll have a roundtable meeting of communities. What do you see in your community? What are things that you've tried? I think these governors, economic development or childcare planning grants, whatever they are, communities might be able to test out things and see, does this work? For example, maybe um, to incent more home-based providers to, become registered. Maybe they could give a grant, let's say it's 25,000 or 3,000 or something. Does that help as an incentive to bring more people into the business of operating their own, family childcare home? Maybe. Or centers. Maybe there's a center that said, gee, I have one infant room, but in my community, there's a huge demand for infant care. I could have 2 rooms. Well, now we know the major renovation category, you could spend up to 350,000. It's a state decision, but if they wanted to partner with some childcare centers to expand infant care and from 1 room to 2 room or 2 rooms to 3 rooms or whatever it is, they could do it. So what I think is it's a huge opportunity for the state to figure out what are its greatest challenges. And I know 2 million more may not sound like, that much in the aftermath of the American Rescue Plan, which was a ton of money, but 2 million is a lot of money. You could do a lot with that. And maybe urge Congress to increase childcare funding for next year. So you have 2 million more between now and October 1, but on October 1 for fiscal year 2025, if there's another increase, maybe it's 5 or 6 million next time. Who knows? I think what it takes is identifying these planning grants, help communities identify what are our greatest challenges? How can we do this? And so maybe bringing those together into some kind of roundtable and talking with the state, there are lots more options.
Grace, I have
Sorry, Janessa, I'm going to ask one quick question or just put a little plug for everyone on the call, just in case I lose everyone. I did have to hop in the car and drive. SDAYC and Early Learner South Dakota is the policy advocacy arm of SDAYC, which stands for South Dakota Association for the Education of Young Children. And we are currently looking at our policy and advocacy agenda items for next year. And I just want to put it out there. If any of you are on this call who are not involved in Early Learner South Dakota, Grace is someone we partner with very often on state work. And we would, if you would like to join the conversation or be a part of our advocacy and policy initiatives, which could very well be advocating for some of these things to happen and change in South Dakota. I put my email in the chat. You are welcome to email me at any point in time. And one clarifying question for you, Grace. So our state currently has $2 million extra that they have to spend by the end of October. Is that correct?
No. You have South Dakota will have $2 million once its share of the state receives annual childcare money. I think it's around 32 million. So when they get the money, there will be a 2 million increase. But the states really have 2 years to obligate that. And so there's a lot of time. Just because the money is received doesn't necessarily mean it goes out the door tomorrow. But yes, there will be a 2 million increase and the potential that there could be an additional increase sometime later in the fall. Rihanna just asked, do we know if there is a plan for the state to apply for a waiver? I do not, but my guess is likely. I think there are probably few states who, like a light switch, can make this happen April 30th. So prospective payments is a big one, I think. whether their software systems are set up to pay in advance of a child or as a child starts childcare, as opposed to being reimbursed. That's kind of a tech change. So my guess would be there will be a waiver, but how many different things they ask for a waiver for,
Mm.
I don't know.
And then Grace, I had a question. It's not, I mean, goes back to your, I think your original slide, which was about the frozen areas. Can you explain what that means? When
Oh,
those categories like PDG, which by the way, South Dakota
yeah.
has never applied for the PDG grant. One of the handful of states that has not, or less than handful now, but can you explain what that means, that those funds are frozen?
What I meant by that, it's like a good thing actually, because when I say the funds are frozen, it means they weren't cut.
Okay,
But like childcare got an increase. So if if funding is held constant, it means it's still going to go out the door. It's still going to be maintained. It will take new applications. It will keep operating as opposed to being cut. So frozen is a good thing. I might have
okay,
used a better word for it, but being frozen is not a bad thing. It's not a great thing because a great thing is if you have an area that needs additional investment, do it.
right. But PDG was one of those that was potentially on the chopping block, or have
Yes. The
drastically reduced
house,
at some point, but it's staying the same and they will accept applications again?
yep, yep. So
Okay.
that's a big one because the House zeroed it out. So the House, eliminated funding for the program.
Mm-hmm.
So for it to come back frozen was a victory.
Yes. Okay.
I see there's the guy, Michael from Aberdeen. So let me mention one thing. Obviously the state has tons of decisions to make about not just the final rule, but the, funding. But I have been working with Kayla, and Aberdeen is one of the communities. One difference in Aberdeen compared to the rest of the state is that, um, you know, family childcare homes are not required to become registered until there's 13 kids in the home in South Dakota.
Mhm.
But in Aberdeen, you're required, once you're a childcare provider, you're caring for somebody else's kids for pay, to be locally registered. And the difference in the mapping on the availability of care and the list, so providers, so that parents know, where do I find care? I mean, it's an amazing difference to see that map. I have different colors, like, blue for centers and yellow for before and after care, and centers, and maybe green for family childcare homes. But when you look at Aberdeen, you go from something that looks kind of skeletal to whoa, there's like lots of family childcare homes and parents know about them and they're registered. And so kudos to Aberdeen for, that was a local community strategy, but it really benefits families in maximizing choices for care and ensures that kids are, in a place that's safe. So lots of good things from that. And you can see it in the mapping. Not that they have enough care for all the families that need it, but when you see the difference with and without that local requirement, it's huge. So the state could, for example, give incentives to become registered, or the state could, for example, say, it used to be that you were required to become registered with 13 kids, but maybe we'll drop it down to 6. The average state requires licensing for family childcare homes at 4 kids. And so there's kind of a big gap. But when you think about supply, if you're a low income family and you want to be eligible for subsidy, you can only use it in a place that's, regulated. So
Mhm.
if you live in a community and there is no regulated care, um, then you have low income families and they don't have choices near where they live to use their subsidy. Um, so there's all kinds of things that can be done. I think the most important thing is this should open pathway for really thoughtful discussions. What are the challenges and barriers in each community, and collectively, what are the best ideas that, you could try?
Absolutely. Well, we are at time. If you have any further questions, please email Kayla at Kayla@kleinvg.com. That was her email. And we will be sure to get this recording out. It'll take just a little bit to be able to upload it. Thank you, Grace, so much for spending some time with us today and helping to explain the new regulations or the new rules for CCDF that has come out. And with that, we'll call it a day. I know Kayla's on the road, so thank you guys very much for being here, and be sure, Darby put Kayla's email in the chat there. Thanks, Darby. But be sure to reach out if you have any questions and if you want to get more involved with our work with Early Learner South Dakota. Thank you all for attending.
Thanks, everyone.